What is FUT exactly, and how does it compare to other methods on the market? This is one of the oldest techniques used in the business, and millions of people have undergone this procedure. Hi, I'm János from HairPalace Hair Clinic, and as a patient coordinator I have accompanied the treatment of more than 1,500 patients in the past 5 years. Today I will tell you everything you need to know about FUT hair transplants and help you decide whether it's the right method for you. FUT, or follicular unit transplantation, is a surgical hair restoration technique that involves harvesting a strip of scalp from the back of the head. This strip is then divided into individual follicular units and transplanted into areas of the scalp where the hair is thinning or balding. The FUT technique is performed under local anesthesia, and the harvested strip of scalp is typically 1 to 2 cm wide and 10 to 20 cm long. The strip is then dissected under a microscope to create individual follicular units, which are typically made up of 1 to 4 hair units. Once the individual follicular units are prepared, the surgeon makes tiny incisions in the recipient area. The grafts are carefully placed at the correct angle and direction to create a natural-looking hairline and overall appearance. There are several potential benefits of FUT, or follicular unit transplantation hair transplants. FUT allows for a higher number of grafts to be harvested in a single session. This typically ranges from 1,500 to 3,000 grafts, or even more, depending on the individual's hair density and the size of the donor area. FUT provides long-lasting results as the transplanted hair follicles are resistant to the hormone responsible for hair loss, which is the DHT hormone. Therefore, the transplanted hair typically continues to grow for the individual's lifetime, providing a permanent solution for hair loss. FUT can be a cost-effective option for individuals with extensive hair loss, as it allows for a high number of grafts to be transplanted in a single session, reducing the need for multiple procedures. FUT can be performed on individuals with all hair types, including straight, curly and baby hair. While FUT, or follicular unit transplantation, has several potential benefits, there are also some disadvantages that individuals should consider. FUT involves removing a strip of scalp from the donor area, which leaves a visible linear scar that may be difficult to conceal if the individual prefers to wear short hairstyles. The recovery time for FUT can be longer than other hair transplant techniques. The donor area may require stitches, and the individual may need to avoid strenuous activity and exercise for several weeks after the procedure. As with any surgical procedure, there is a risk of infection after FUT. While this risk is present with other techniques too, it is much higher with FUT due to the way the grafts are harvested. The large linear scar creates an ideal spot for bacteria growth and subsequent infection. As this technique removes a large strip of skin from the patient's head, there is a higher chance of bleeding too. The cost of FUT surgeries in the UK can vary widely depending on several factors. On average, the cost of an FUT surgery in the UK can range from £3,000 to £15,000 or even more. In addition to the cost of FUT surgery, individuals should also consider the cost of post-operative care, such as medications and follow-up appointments. It is recommended that individuals consult with several qualified hair restoration surgeons to discuss their specific needs. Here is a comparison of FUT with other common hair transplantation methods. FUE involves harvesting individual hair follicles from the donor area using a specialized punch tool. This method does not leave a visible scar, but it can be more time-consuming and may result in a lower yield of grafts compared to the FUT. This method uses robotic technology to assist in the extraction and the placement of hair follicles. It can be a more precise method, but it may also be more expensive. DHI uses a CHOI implanter to extract and implant individual hair follicles directly into the recipient area. This allows for more precise placement of follicles, and unlike FUT, it doesn't cause linear scarring. FUT is generally recommended for individuals who are suffering from widespread baldness. This method is capable of extracting a large number of grafts in a single session, which means it can often cover large areas with just a single surgery. The most important thing with any method is to have adequate donor density and to have a stabilized hair loss pattern. FUT often ruins the donor area of patients, which eliminates the chance of future surgeries. Now, while this isn't a problem for patients with stabilized hair loss pattern, it can quickly turn into one if your hair loss progresses further. It is essential to consult with a qualified hair restoration surgeon to determine if FUT is the right choice. The surgeon can evaluate your hair loss pattern, hair density, scalp laxity, and overall health to determine if FUT is a suitable option. While FUT is an effective way of restoring your hair, it is far from the best option. It leaves you with a large permanent scar across your donor area. While FUE is more expensive, it is certainly worth the cost. FUE leaves no visible scars and offers a faster recovery time. There is no need for stitches or staples following the procedure, and the patient can return to their normal daily life almost immediately after the surgery. Additionally, as it is a much less invasive option, the chances of complications and infections are also much lower. FUE is by far the best method of transplanting hair. What do you think? Would you prefer FUT or FUE? Let us know in the comments down below. And if you enjoyed this video, subscribe to our channel. We post new videos every week so you can take a look at success stories and learn more about hair restoration methods that can help you overcome hair loss once and for all. Thank you for watching.